Um, Thank you very much for the introduction. My name is Rosana Weldon. Most people actually call me Sani, so feel free to call me Sani as well. I'm the director of the Red Hill Registry, and I'm also an environmental health scientist by training. I work as faculty in the Office of Public Health Studies with Dr. Catherine Burkle, who I really wish had been here today. So we're here to discuss the Red Hill spills, primarily the jet fuel story at this point, and the health implication from this exposure. I'm sure that many of you have seen headlines regarding Red Hill over the years. I just wanted to point out a few things from these headlines. First, these leaks were first reported about a decade ago in 2014, and there hasn't always been clear communication to the public about the extent of the problem, like what the leaks were and who might have been exposed. As of 2015, there was a plan to upgrade the tanks. But we see that in 2021, there was another Red Hill fuel spill that made huge headlines. This time, the leak was big, and the public reported fuel odors. They noticed the smell in the drinking water. And this time, the Navy immediately admitted that there was a problem in the Navy water system. So today, we're going to discuss some of the background information about Red Hill. We'll also talk about the human exposures from the spills, the potential and reported health effects regarding these spills, and where we are now in terms of the water quality, the defueling process, and what is being done about the ongoing health issues. I thought I would start with introductions of some of the major players in the story. So here are some of the federal organizations that have been involved. The United States Navy is the operator of the Red Hill bulk fuel storage facility. They're responsible for the Navy water system too. The Environmental Protection Agency has been working to regulate the facility and clean up the contamination and to prepare plans for the defueling and the closing of the Red Hill facility. The Defense Health Agency Public Health is working to understand any potential long-term health problems related to the fuel releases and provide any essential health information that is available. And the Agency for Toxic Substances and Disease Registry, which is under the Centers for Disease Control and Prevention, they've been trying to conduct these public health assessments to determine whether people were exposed to toxic substances and what their health effects may be from this exposure. There are also several organizations in Hawaii, specifically, that have been working to address the issues resulting from the Red Hill spills. The Department of Health has been pivotal in working with federal regulators and the community, both on environmental and health issues. The Board of Water Supply has been advocating for protecting our drinking water and remediating the contamination. The University of Hawaii Water Resources Research Center has been an ally to the exposed community from nearly the beginning, where they were asked to test water from some of the affected homes, residents. The Oahu Water Protectors is a grassroots community organization that has demanded that the Navy shut down Red Hill. I'm sure you've seen some of those bumper stickers. And finally, the Sierra Club of Hawaii and Earth Justice have been leading a legal charge to shut down Red Hill. You'll also notice I actually added a new bit to this slide. Oh, I have it pointer. Sorry, learning how to use the pointer. Oops. There it is. We'll talk a little bit more about the role of the University of Hawaii System Office of Strategic Health Initiatives towards the end. Here's a little orientation to the region that we'll be talking about today. This is a map of Oahu, as I'm sure you all know, and the orange circle depicts the Red Hill area. As we zoom in, I want to point out some landmarks. The red dot is the Red Hill bulk fuel storage facility. The blue dots show the nearby water shafts and wells, including the Red Hill water shaft that is just downhill from the fuel storage facility. The yellow dot shows Red Hill Elementary School, which is not the only school in the region, but it just goes to show how close everything is. Then the purple dot is a correctional facility. I just want to show how close the Red Hill bulk fuel storage facility is to really everything, particularly some vulnerable populations, including children and prisoners. In the center, of course, is the Joint Base Pearl Harbor Hickam area base. This is a depiction of where and how the 20 fuel tanks are situated along both the Mauna Loa and the Waimalu aquifers. This is a bird's eye view looking from the top of the whole facility. And you can see where the Halava shaft are, the Red Hill shaft, all these wells. The Boko fuel storage facility, one slide that I actually meant to have here is I meant to show that this is underground here. So as wide as this tank is also the short distance that these tanks sit above our aquifer. So you can start to think that maybe it would not such a great idea to have these giant tanks full of fuel so close to our water. This whole facility was built in the 1940s, and it was actually kind of an engineering marvel at the time. It's built about 3 miles uphill from the base, and it obviously stores about 12.5 million gallons of fuel per tank. So it's a lot of fuel stored uphill there. This just helps to give a little perspective on the size of these tanks. So you can see they're about 250 feet tall, and I'm sure a lot of you are familiar with the Makapu Lighthouse. You could fit about 5 of those in here. Another way to think about it on, more of a national scale is that you could just about fit the Statue of Liberty inside one of these fuel tanks. They are massive. And they're built, the way that they're built, you'll see on the left side, they're built mostly out of concrete, but there's a 1/4-inch steel liner. Now, concrete is porous and it is not suitable for storing fuel itself. So really, you're just relying on a 1/4-inch steel liner to protect the environment and people from any leaks. Now that these facilities are also susceptible to the environment, and there's no way to access them to make sure that they are sealed. There's no way to paint them. There's no way, to really maintain the outsides of these tanks. So here's a look at the same region, but with clearer boundaries that delineate who gets the Navy's water. About 9,600 households are served by the public Navy water system, including the work sites, the businesses, schools, daycare centers, medical facilities, and even shopping centers. So we've heard that it's estimated that roughly 93,000 people were exposed to this jet fuel in their drinking water. Although we really haven't been able to track down, it is not just us, nobody has really been able to tell us how exactly they derived at that number of 93,000. So it could be bigger, could be smaller. So now we're going to move into the exposure piece. So now that you're familiar with the facility, we can talk about how it has impacted our island. So Navy records indicate a lot of spills, and even they say that they don't know exactly how many spills have occurred since the 1940s. But they do, and they also don't know exactly how much toxic fuel and other substances may have been released into the environment. Apparently, the first recorded spill was as far back as 1947. And certainly I can't cover every single thing that ever happened to that facility in this 45 minutes, but I'll go over some of the highlights of what have happened in the last decade. So the first major public incident was in January of 2014, when 27,000 gallons of JP8 fuel was spilled during the refilling of fuel storage tank number 5. So I didn't mention it yet, but this whole facility, when it was built in the 1940s, was a real top secret mission. Nobody knew this existed. That probably is what saved this facility from bombing during Pearl Harbor. But this facility was also declassified in 1995. And yet it was only due to this 2014 event that the Honolulu Board of Water Supply first heard that this facility even existed. And that was even thanks to a whistleblower at the time who called and alerted them directly of the spill. A year later, the Hawaii Department of Health, EPA, and Navy, and the Defense Logistics Agency entered into an administrative order on consent that would require the Navy and DLA to address the fuel releases and to implement infrastructure improvements to protect human health and the environment. This is kind of a lengthy slide, so bear with me. In 2020, there were more fuel releases into the surface water of Hotel Pier. In May of 2021, there was another leak of 20,000 gallons of fuel that went into the floor and flowed into a sump. automatic pumps transferred the fuel into a 14-inch PVC pipe where it stayed. And then in July of that year, it was noticed that there was already petroleum detected in the Red Hill well. Now, the big event, on November 20th, 2021, a drain on that PVC pipe fuel was hit by a worker that was driving a people mover, is what I understand. This caused the rupture and release of 14,000 gallons of JP5 fuel. The fuel migrated downward through the rock, the basalt, and it reached the water table and was drawn into the Red Hill shaft. That's what caused the water crisis, potentially exposing all these people. So then there were plans to defuel Red Hill approved by the Pentagon in March of 2022. Things actually start to happen pretty quickly after this because this was a really big and newsworthy event. But at the 1 year mark of the water contamination, there was yet another spill in November of 2022. But this time, I'm sure you've heard of PFAS. Those are the long name is perfluoroalkyl substances were released. We're not really going to talk about that too much today, but just note that that's another chemical that may have been involved in these spills. As of March of 2024, the tanks are considered defueled with nearly all of the fuel, 104 million gallons removed from the tanks. So now the tanks are being degassed and cleaned and scrubbed, and the complete closure of the facility is underway. Okay, so this is just looking at November and December of 2021 because things move really rapidly in this particular time frame. As we just saw, the JP5 fuel spill happened on November 20th. Just a few days later, 911 calls were received reporting a fuel smell in some of the neighborhoods near Red Hill. And then in November of the Navy released water samples that were the results of the samples taken between July and October of 2021. On November 28th, the first public reports of a chemical smell in the water are recorded. These were mostly 911 calls and also calls to the Hawaii Poison Center. And as it turns out, there's a program where if 30 calls are received on the same sort of incident in the same sort of area, then it triggers a sentinel event warning. And so this is when they started to figure out that there was a real problem here, and it's really in this particular location. So the next day, I'm thinking I'm a little behind here. DOH advises Pearl Harbor Navy families to avoid the tap water. And they also have some health advisories, and they're noticing some health issues are being reported. On November 30th, the Navy advises residents to help flush their system. You basically run the taps, run the hydrants, run it all. And in the next few days, more things happen. There's petroleum detected in the Red Hill Elementary School water. The Navy confirms the petroleum detection in the Red Hill well. The Board of Water Supplies shuts down the Halava shaft, and the governor and members of Congress call for the suspension of the Red Hill facility and the release of sampling results to the public. The state also puts out an emergency order for the suspension and defueling of the facility operation. And an entire 4 months later, the water is declared safe in March of 2022. I'm going to actually skip that one. So this is a heat map of the calls that were received on November 28th and 29th. And this map is really important because it really shows where the problem is. This is not an island-wide problem. This is a local, geography problem that there are odors detected. So you must be wondering, what are all the chemicals that people were exposed to from the spills? And it really looks kind of simple, doesn't it? Look, 3 little chemicals, no big deal. But it's actually a lot more complicated than that. So JP5, JP8, and additives are some of the things. PFAS, of course, we heard about, but as it turns out, jet fuel is an extremely complicated substance. JP5 is also, the long name is jet propellant 5. It's a total petroleum hydrocarbon. It's mostly used in aircraft fuel, but it can be used in other sorts of vehicles. It's colorless, flammable, and it's a lot like kerosene. These jet fuels are made in oil refineries from hydrocarbons. So each batch is a little bit different depending on the refinery that it's made in. And so you can see here on the table, there's a whole lot of chemicals here. And these four at the bottom, these are what are typically called TPH, total petroleum hydrocarbon, and what is measured as TPH. But these are actually all these different carbon backbones represent hundreds of other chemicals. So the term total petroleum hydrocarbon is a large family of chemicals, and there's not a lot of information in the medical literature on the health effects of TPH in humans. And especially in this particular exposure scenario where you would never expect to have hydrocarbons in your drinking water. But we can estimate some of these health effects using principles of toxicology and other exposure models, and even some occupational exposures of jet fuel in general. We know a lot of information about benzene and naphthalene in particular, and those are known to cause human harm even at very low levels. So the amount of TPH in a sample, it can indicate petroleum contamination at that site. And then what is hard is that any individual chemicals within the sample can be hard to assess and to figure out exactly which chemicals may be causing a health effect because it's such a complex chemical mixture. So we also know the Navy has confirmed that the Red Hill facility contained this additive. It's a fuel system icing inhibitor. It also contained antioxidants and corrosion inhibitors. This primary compound is called diethylene glycol monomethyl ether, or it's called diagme for short. And from animal studies, diagme has been found to have acute health effects itself. You can see these listed in orange: headache, dizziness, tiredness, nausea, vomiting, eye irritation. And there's also some long-term impacts that have been determined: gastrointestinal tract and skin problems. And I just, among other problems, want you to take a note of these in orange in particular, because we'll see them again in a minute. So you may be wondering now about the water quality. So pretty soon after the November 2021 spill, Dr. Don Viviani, a professor at Leeward College, started receiving calls from local residents. And they wanted him to test their water. They wanted to know what was in their water. So he has connections with researchers at the University of Hawaii Water Resources Research Center, and they were able to kind of develop a minimal screening program for residents to be able to submit their water. This was not like a strategic testing program. It was just concerned residents would reach out to him. This is just a screenshot of the Red Hill Information Hub hosted by the WRRC, and it's meant to inform the public of the latest updates regarding the Red Hill, not just, their particular water measurements, but also, any news regarding Red Hill. This information hub also displays the tap water screening data, as I mentioned, that they had. They use a fluorescence spectroscopy method that is not really meant to actually quantify the amount of a chemical in the water, but it's really meant to just say yes or no, it's present. So that's why you can see kind of dots with different color intensities, but not actual concentrations. But you can definitely go to the website and explore these data. This interactive map shows the public schools on the Navy water system and demonstrates the number of potentially impacted students. As I mentioned, a vulnerable population, a developing population following the fuel spill. There are also, we should keep in mind, impacted daycare centers that are not depicted here, but they were receiving the Navy water as well. And this is just a snapshot of the Navy's drinking water monitoring dashboard. So not sure how updated this particular screen is. Looks like maybe it was from January, but they've measured over 8,000 samples at this point between their long-term monitoring, and now they have an extended monitoring program. So they actually test for a lot more than TPH. If you use this website, you'll see here, you can search by analyte name and so many different chemicals. You can start to see the list over here. But what they say is, sorry, not sure what's going on there. There we go. So this is an interesting story. This is a little bit controversial. They say that a lot of the TPH that they've detected in the water was actually due to interference with chlorine in the drinking water. Now, we all sort of know that there's chlorine in every drinking water, so it's a bit of a pill to swallow to hear that. And these figures represent the TPH results for all the residents that were sampled by the Navy during the long-term monitoring period 1 through period 7. So according to the Navy, most of the samples where TPH was detected have concentrations that are less than 100 micrograms per liter in all the zones. So they say that anything that detected was low. And the frequency of the TPH detections in the zones that did not receive the water from the Red Hill shaft, those are circled in blue. And then the things that are circled in yellow are zones that received the majority of their drinking water from the Navy water system. As I just mentioned, the Navy said that much of the TPH that was detected was due to chlorine interference. So the zones circled in pink were fitted with special granular activated carbon filters that are meant to filter out any fuel that may have been in the water. So based on this and other evidence, the Navy concluded that the low-level detections are significantly impacted by laboratory, contamination issues and ghost peaks, and that basically, there's low or no TPH in the water. But, I think some of that story needs to be examined a little bit further. So many of the chemicals of concern will enter the body through ingestion of the water, particularly in this scenario, but also remember that they were flushing the water out into the environment. And so there may have been inhalation exposure. There may have been dermal exposure, obviously, for showering or washing dishes or what, you use your water in a lot of different ways in your home. And these chemicals are volatile, so they are very easy to breathe once they are in the environment. Fortunately, the CDC, Agency for Toxic Substances and Disease Registry, put together a toxicological profile for jet fuels in 2017. So we should be able to figure out what the health effects are from this kind of scenario, right? Well, that isn't exactly the case. It turns out that much of what we know from exposure is in populations of young men, particularly in occupational exposures. So people who work in airports, people who are in the military, and are exposed as part of their jobs. So we have no idea really what health effects may be in vulnerable populations, developing populations, pregnant women, for example. There's some evidence from animal studies. Sorry. Didn't realize I would do that. But there are almost no studies of oral exposure or ingestion. Occasionally, there are poisoning scenarios where children have drunk kerosene, and there is a very terrible health effect from that luckily we don't have evidence that anybody experienced anything like that. So in particular, we know that pregnant women or children are more vulnerable and susceptible to health effects in general. Pregnant women can transfer chemicals in utero while they're pregnant, but of course, once they deliver the baby, they can also transfer chemicals in breast milk. And children are in a period of rapid growth and development, so there can be critical windows of exposure that we really have no understanding of regarding this exposure. We know that children eat, drink, and breathe more per unit body weight than not sure why this isn't working. Than adults. They also have different behaviors. They tend to put their hands in the mouth. They tend to crawl around on the floor. And so that can also put them at additional exposure risk. They are probably more likely to drink the bathwater, for example. So how much jet fuel were people exposed to? Well, that's a really great question because no one really knows. And that limits our ability to really estimate potential health effects. Much of the fuel had been flushed from the system by the time any samples were drawn from the residents' taps. So concentrations and samples that were collected would have been low anyway. We know that people were exposed to higher concentrations that we were able to measure in any samples, especially early on in the incident. Also, some homes were likely to have higher exposures than others due to, maybe the way that the infrastructure is set up, or the age of the infrastructure, or maybe, the age of the pipes even. So you may be wondering why you don't just test the blood or urine of people who are exposed. Well, you can if you get a sample very, very soon. But it turns out in disaster scenarios that rarely happens. The more registry people I talk to, the more I'm realizing that maybe it's a logistical problem. I'm not sure what the issue is, but human samples are rarely collected at the time of exposure. In addition, DOH put out an advisory. People wanted to get their samples tested, but at the time, it's true. As I mentioned before, this is a complex chemical mixture, so it's hard to reliably connect this particular exposure scenario with JP5 in their drinking water. There may be other sources of fuel that people are exposed to. There may be lots of other chemicals. There basically can be a lot of interference. And so it's really hard to sometimes extrapolate from the data. And of course, if you're going to different sort of laboratories, it would be really hard to compare data across. But, instead of doing this sort of, detailed individual level exposure assessment, DOH considered anyone who was in the area or came in contact with the water as potentially exposed. So now we're getting to the part you've all been waiting for, the health effects. So there were a lot of complaints about headaches, lightheadedness, coughing, rashes, stomach upset. Fortunately, there weren't any, as I mentioned, that serious pneumonia-like illness that you can get from drinking like lighter fluid. But for the most part, the reported symptoms fit with what would have been expected from this type of exposure. And many of these, as I mentioned, remember those health effects in orange from the diagme. So a lot of these symptoms that we see here from TPH exposure are also potential health effects from the diagme exposure. And here we're showing the distribution of symptoms described in complaints to the Poison Control Center. Those are in blue, and the symptoms described to emergency department visits in orange. There were significantly more poison control calls than emergency visits. So DOH has been looking at the percent of calls or ED visits reporting each of the symptoms. You can see that there was a lot of throat irritation. There was a lot of headache, kind of the same that we just saw as would have been expected. I also want to kind of point out a little bit of a confounding factor, that the timing of this event coincided with a COVID, like a surge in the Delta variant of COVID. And so you can see a lot of these symptoms also sometimes occur with COVID. So it's not always easy to tease apart what is a result from what. So, as I mentioned, the CDC and ATSCR have been involved pretty much close to the beginning. In January and February of 2022, they conducted the first assessment of chemical exposures. They're called ACE studies. This was self-administered and interviews. They contained questions about potential exposure to contaminated water, any symptoms that people experienced, and whether medical care was sought, among other things. So there were 2,289 participants of this first ACE study, and it seems like a lot, but when you start thinking back to 93,000 exposed, it's actually just a small fraction of the population. So the most common individual symptoms were headaches, dry and itchy skin, diarrhea, and of course, there were huge mental health impacts that people reported. These were particularly alarming. There are hundreds and hundreds of mental health impacts, including anxiety, depression, stress, and post-trauma symptoms such as difficulty sleeping. And actually, interestingly, hundreds of people reported symptoms in their pets too. So it wasn't just humans who were affected. It's also striking to point out that 75% of participants reported that their symptoms lasted more than 30 days. Most of the time we think about getting a headache or something like that, or stomach upset, it goes away pretty quickly. But these people are having persistent symptoms. So it soon became clear that people continued to have symptoms months after exposure. So in September of 2022, so now, 9 months after that first ACE survey, The second follow-up survey was conducted. This again was self-reported, and this time 986 people participated, and 61% were returning participants from the first ACE survey. 90% of these participants were affiliated with the Department of Defense too, which is interesting to think about, because there's a lot of fear of retaliation, and really it's been sometimes hard to reach some of these populations who don't, they experience the trauma, so you don't want to re-traumatize them, but they also don't want to experience any sort of retaliation for, if they're themselves or their family member who may be active military. So these, these results are not exactly published, as this is a preliminary report so far. 95% of the people switched to an alternate water source during the incident, which is good. And 85% were still using a different drinking water source, this long after. More than half of the participants had changed their behavior regarding their water use. I don't know why I can't grab that. Okay. Their household budgeting, social interactions, or mental health due to exposure concerns. More than half the participants changed their behavior on those things. 80% of participants reported health symptoms in the previous 30 days. So we are 9 months out and they're still experiencing health effects. And 65% of them were really very confident that these health effects were related to the exposure. So as we saw before, some of the common reported symptoms were anxiety, skin problems, fatigue, difficulty sleeping, and 50% reported worse mental health after the incident compared to before. So it's the same kind of things we're seeing as in the first ACE study. And in particular, participants expressed frustration with communication, transparency, and trust of the agencies involved. So this is now the third ACE study. This in particular was a little bit different because it was a medical record review. And the exposure window for this was defined as November 20th, 2021 to March 18th of 2022, where they reviewed the records in that window. 653 of those medical records were abstracted, and they were looking at, they basically would flag health conditions. So they looked at particular ICD-9 codes for different toxic effects and outcomes of interest. And they also specifically looked at children and people who were pregnant. So 63% of the records were adults, 55% were female. For uniformed service branches, 35% were Army, 30% Navy, 27% Air Force, 7% were other branches. And preliminary findings show a higher percentage of adults versus children that were abstract, that have reported symptoms and conditions. Many of the same conditions and symptoms were represented as both new and worsening in different individuals. And again, they report things like rash, migraine, and chronic pain. And a higher percentage of males versus females had written documentation of contaminated water exposure in their medical records. That's kind of interesting. So looking across, we see the types of worsening pre-existing conditions frequently reported, as well as new persistent conditions. And there seems to be significant overlap between the two. And below here are the types of conditions, and they're stratified by age group. Down here among children, you seem to see skin issues and ADHD, and then new persistent allergic rhinitis and eczema and skin issues. And then in adults, you see more migraine, anxiety, chronic pain, and for persistent migraine and hypertension and adjustment disorders. So in January of 2024, here's yet another research project. Researchers from the University of Hawaii Economic Research Organization, you sometimes hear that as UHERO, and WRRC administered a survey to 174 Navy water users who participated in the 2021 and 2022 ACE surveys. Overall, 79% of survey respondents said that they experienced a new or worsening physical or mental health symptom after the November 2021 spill. And the majority of those people said their symptoms are ongoing, meaning that they continue to experience these health impacts even 2 years later. mental health and neurological symptoms were the most widely reported, and nearly half of the respondents reported ongoing symptoms, including GI symptoms, skin and eye symptoms. Notably, about 92% of the respondents reported shifting to an alternate water source. And even now, 2 years later, many of them, 84%, are still using alternate water sources. So when they're asked about the perceived effects of the fuel spill on their household, mental health issues were perceived as having the greatest impact. 81% of respondents said that their household's mental health was impacted or very impacted. And this was followed by physical health, with 74% reporting. Recreation and leisure and finances were also impacted. Social interactions, educational work successes were impacted or very impacted. The thing to think about also, this affected families financially as well. And of those reporting financial impacts, from slightly impacted to very impacted, over 40% report that they continue 2 years later to experience financial setbacks related to the event and its aftermath. They also assess satisfaction with institutional response to the crisis, and this varied. You can see that in general, the population was very dissatisfied with the Navy and rather satisfied with the Board of Water Supply's response. So where are we now? First, I want to mention there was significant community action with protests, lions demanding that Red Hill be shut down. There was also legal action taken by the Sierra Club and Earth Justice, and these efforts have led to change. EPA, in collaboration with Navy, Defense Logistics Agency, and members of the public, held a scoping meeting to discuss the formation of a community representation initiative. Most people know this as the CRI. You might hear about the CRI in the news. And that was formed in July of 2023. And it was added to the 2023 Red Hill Administrative Consent Order in response to the public comments. It gives 10 members of our community an opportunity to work directly with Navy, DLA, and EPA on matters related to the defueling, closure, and the safety at the Red Hill bulk fuel storage facility. The Water Alliance Initiative is a working group consisting of state and city leaders. In November of 2023, they released a report that called for access to all of the Navy's monitoring well data and to step up testing. The report also concludes the federal government is liable for efforts to reimburse all cleanup efforts and to reimburse the state for any efforts that they put forth, as well as county and individual Hawaii residents who incurred costs as a result of Red Hill. So I'm sure you're all wondering, the real question is the water safe? You may have seen earlier that the affected region was divided into 20 zones. All of the water mains were flushed through those carbon filters. Then one by one, the Navy flushed the plumbing in each residence and each facility. All of the zones were cleared by March 18th of 2022, which is, as I mentioned earlier, 4 months after the incident. So essentially, billions of gallons of water were used in this flushing process. We think about always conserving water, so that's a little horrifying to think about, but necessary nonetheless. And then thousands of samples have been taken and testing has been done mostly on the mainland. So at the moment, the Navy and EPA report that the water is safe to drink by drinking water standards. But the community members are still wary. As you saw in the ACE surveys, there's plenty of community members that are still drinking alternate water sources. There are other environmental ongoing activities, including the extended monitoring of the drinking water system, the defueling, which is pretty much complete at this point, and the facility is on its way to being closed soon. There's, of course, work in aquifer recovery and environmental remediation that needs to be done now. So I want to wind this down with a comment on the long-term health effects of these exposures. For the most part, they're still unknown. From the available literature, long-term health effects weren't expected. But now we have some evidence that many people are experiencing symptoms 2 years after the incident. So these symptoms may be similar to other complex health problems when you start thinking about things like long COVID or chronic fatigue syndrome. It's this sort of collection of symptoms that it's not quite clear what's going on always. And so to help people address these health issues, a Red Hill Clinic was established. and that it was open to community members for a while. I'm not actually sure of its status at the moment. The Department of Defense began keeping track of people who were exposed. ATSDR has performed this medical record review and their studies. The Defense Health Agency, Public Health, has provided additional support for medical personnel to try to help them become more aware of the exposure and the potential health issues. And they've been working with ATSDR and the National Center for Disaster Medicine and Public Health to establish an independent third-party registry. So in early January of this year, plans for this independent registry were announced by Colonel O of the Defense Health Agency. And the purpose of it would be to track the health over time and provide information and support to participants. Of course, this would be an opt-in registry. And so if you wanted to be a part of it, you would have to elect and consent to be a part of the registry. We're pleased to announce that the University of Hawaii system was awarded a cooperative agreement to begin this health registry. We have this press release that went out on June 20th, 2024. It actually coincided with a CRI meeting because we really wanted the public to be aware of this registry, in the largest platform possible. And really the point of this registry is, a large part of it is to be co-created with the community, because we can only serve them if we know what all the needs are and support them in the best way possible. The goals of the registry are simple. We want to provide the community with connections to health and social services as they are needed. We want to develop educational materials for the impacted community, the community at large, and especially important are the medical providers that these community members may now be seeing. Now, when you start to think about this population and you remember that they are a military population, many of us probably don't even know exactly what that means, but I think what I understand is that Hawaii is considered an overseas duty station. And so your time here on island is limited usually to about 3 years or so. And so since it has been 3+ years since the incident, it's likely that a lot of service members have already moved off island. And so we have to think about this registry globally, not just locally. And so also on that point, as these individuals have moved away from the island and they're seeing different sorts of healthcare providers anywhere in the world, they now need to be aware of the importance of conveying this exposure to their healthcare providers. And so part of what we're trying to do is to develop educational materials so that these providers can be aware of the incident, like a fact sheet that patients can take with them to their doctors. We're thankful to the Flint Registry, is run by Michigan State University. They've been a wonderful model for us to follow. Some of our issues are a little different, but it's nice to have kind of an idea of how this can be structured. Also wanted to let you know that we set up a very basic website so that community members and interested individuals could sign up for updates on the registry. Importantly, we just began in June. So we are in a planning phase for this year. We don't expect to actually enroll anybody until fall of next year. But we wanted this website, we made it very intentionally basic because, as I mentioned, we want to co-create everything with the community. And so we're not quite there yet with reaching out to the community for what they want, even, the look and feel of the website to be. If you would like to sign up for updates, you may use our QR code here, or you can go to our website at redhillregistry.org. Oh, sorry, one more thing. Also wanted to show you really quickly, I don't know how many of you are looking for jobs at this point, but we do now have an employment button. We're working really hard to staff up our registry. So if you know people in, health field or related who may be looking for jobs, check back with us every once in a while. We pretty regularly have jobs posted there. So thank you very much for listening today. We'd like to acknowledge the Red Hill community who recognized a problem and have fought for answers. We're getting there. Thank you.
Thank you, Sani, for an informative and a little alarming talk. Are there any questions from the audience? We'll alternate between the in-person and the online.
Can you tell me if the Manoa wells were affected by the Red Hill spill?
I definitely do not profess to be a water expert. So I'm going to say I don't know the answer at that point. At this point, I know the Halava wells were shut down and, Red Hill Shaft. I'm not sure about the Moanalua wells.
This next question, actually, there are two questions related to this. Both of them are talking about the aquifers on Oahu. Are they connected? And
Yes.
if so, isn't the water supply to the rest of Oahu also contaminated? And are they testing all of the different aquifers?
That is a big question mark right now. There's a thought that yes, maybe there is this plume sort of dancing around. The aquifers are connected, and there are very special, water scientists who are looking very deeply into this problem for sure. In fact, I just went to a fuel tank advisory committee meeting. Actually, it was the DOH open house 2 weeks ago, and they had pictures of what they think the groundwater, the amount of TPH in the groundwater could be. So those are all public on EPA's website.
Where did all of the flushed fuel go?
To the environment.
Yeah, how effective is that? How non-polluting is that?
Well, this is a very volatile chemical. Well, jet fuel is very volatile, so is likely a lot of it went up in the air. Yeah.
Next question is, other than flushing, are there other known means to effect removal of chemicals that are feasible either on a large scale system or for individuals in their homes?
Well, interestingly, they do feel like those carbon filters, granulated activated carbon, GAC filters, what they call them, are effective. So I think those, I think in-home water filtration systems are probably sufficient. I am not an expert in that either, though, but I am just relying on what I know that they use to try to remove any fuel from the water on a larger scale.
Okay.
Perhaps you could explain the components of the jet fuel itself. I understood that the additives were added to diesel to help it burn hotter and faster, but that the basic premise of diesel still has lead and other components that over the long term can be cancer causing. Even as we've heard of, burn pits and other things that the military has applied, but exposure to even diesel pollutants in the atmosphere has shown that it's cancer causing. So do we really know the long-term effects of this spill?
You are correct that this is a very complicated substance with a lot of chemicals in it. And I think that is one of the reasons that the Navy's, water testing system has so many chemicals listed. It's actually pretty easy to search that website for which chemical you're concerned with. And you can also filter for exceedances, not just detect, not detect, but whether it's exceeding any sort of, benchmark for health effects.
How can we test the water in our own homes to see if it's safe?
I think that's a good question. I don't actually know the answer because I think the Navy is responsible for doing the testing right now. So the Navy says that they are testing all the homes. Now there's also a new system, this extended drinking water testing program, where some fraction of the samples are split and EPA is independently testing them as well.
My question is related to the testing, and I realized that there was some water testing, but because you're indicating that there's a lot of volatile materials, so it goes up into the environment, and then it probably comes back down into the soil surrounding that area. So my question is, were there any testing of the soil in the local area to see if concentrations of whether it's lead or whether it's hydrocarbon built up into the soil? Was there any testing of that?
I don't know that environmental piece. I think it would be certainly important to consider. I think there is testing probably around the tanks themselves. There are, like I said, there are pretty high level scientists who are looking at the environmental problem as a whole. But I don't know the published literature around the environmental piece. Or if there's any yet.
What is the status of legal or monetary suits? Are they having any traction, and when will they be resolved?
What I understand is that there has been a lawsuit where all the evidence has been heard and that the judge is currently deciding. But so I think all the evidence was heard by the end of the summer is what I understand. But the judge can take even, years to decide. I think she's weighing all the evidence. And this is a bellwether trial. I don't understand all the intricacies of how this is, but I think it were 18 affected individuals who are part of that particular suit. And then after that is decided, other things may happen.
So I noticed that we've not talked about anyone dying from this humongous environmental disaster. How are we going to know how many deaths have occurred or will occur or whatever?
That is a good question because at the moment, nobody is, really linking or knows links between jet fuel exposure in drinking water with actual disease. There's all these symptoms reported, but, that is something that we're hoping the registry can help to answer once we know more information on a larger population and we're able to follow them over time. We'll see if patterns emerge. That's the goal anyway.
I don't have any more questions online. Any more from the in-person audience?
Is there any forensic evidence that chemicals are retained in the body? Like, did they test it from the very beginning to all the people that they're following?
So we do not have biological samples from the individuals who were exposed. This is actually a question and a problem that I've been thinking very deeply about lately, because when you think of some of these chemicals, they're very short-lived in the body, usually. Usually they're excreted in the urine pretty rapidly. Sometimes there's also these DNA adducts where, some proteins or such might be attached to some of the DNA in your body, but even that is not long-lived. And so now we're thinking about things like biomarkers of effect. So usually we think about biomarkers of exposure where you measure a particular chemical in blood or urine or some biological sample. That would be biomarker of exposure. But now we're looking at things like biomarkers of effect, like are there proteins or DNA markers or other sorts of chemicals in the body and metabolites and such that may be affected by the chemicals that we can measure and maybe link back to exposure. So we're thinking about this problem, but we don't know the answer yet. I feel like I'm saying I don't know a lot, which is very frustrating to you all, I'm sure. It's frustrating to me as well. I wish we knew more.
One last question.
How are you able to track the military families that have been reassigned to the mainland or elsewhere? And are you able to get input from them?
So the military family piece is a little bit easier actually than some of the community exposed individuals. The military actually does keep track. They have this it's called DOORS, Defense Occupational Environmental Health Readiness System, where they know who was where during which exposures. And so we actually have a data sharing agreement with DoD to be able to contact 55,000 service members and people affiliated with DoD who are in that DOORS registry. So we have a head start, but they still need to elect to participate in the registry. We can contact them, but they still need to opt in.
Thank you very much, Sani, for again a very informative but alarming
Thank you for having me.
session.